Okay, so today's video is going to be on shin splints. I picked this topic because it's something that a few clients have brought up to me. It's something that they've suffered before in the past. As we get towards running season, it's something that we've got to make sure we prevent. And as the weather gets warmer, more and more people are going to be start running. So I thought it was a good topic to talk about. So shin splints, medical name is called medial tibial stress syndrome (MTSS). It's characterized by frequent overuse of lower extremities. So it's an injury that you see often with athletes, runners, as well as military personnel as well. And it's exercise induced. You're not really going to be getting that sort of pain from anything else. And it's over the anterior tibia. That's why it's called medial tibial stress syndrome, because it's over the front left part, or front right, but front inner part of the tibia. And it's an early stress injury in the continuum of tibial stress fractures. So what we can see is from this injury, it can lead on to stress fractures. It has a layman term of shin splints, and that's probably what you've heard more often. When we look at the epidemiology, so we look at the statistics, the incidence ranges between 13 to 20% in runners and 35% in military recruits. Now, this is important as we go into sort of the understanding of theories behind why this happens, because it's a drastic number from 15% more military compared to runners. What is it that military personnel do compared to runners? And when we're thinking about being called a stress syndrome, mainly the reason for that is stress. So the amount of pressure that's on this area, on this bone, is going to be more military recruits. So they're doing more intense, longer intense exercises day in, day out. So we'll get into more of that later. But if we look at the anatomy of the tibia and everything that's around it, on that front part of that bone, on top of it, you've got several layers of different types of tissue. And one of those tissues is called periosteum, which is like a sheet that goes over the top of a bone. And often what you can see is called as diagnosis that comes with it is periostitis, which is aggravation and inflammation. The itis means inflammation. You can get that with a lot of medical terms, but when it comes to inflammation, this area of this bone is highly innervated with a lot of nerve endings, meaning that it's very likely to be subjected to high levels of irritation and pain that you can feel. Now, one of the main theories for how this pain occurs is that there's a connective tissue called fascia on top of this, and what can happen is muscle in the surrounding area, let's say the calf muscles, the gastrocnemius, can pull on this area and cause irritation to this periosteum, which is very innervated, therefore leading to more pain. Now, if these areas of muscle are poor functioning, they lack strength, and they are constantly under a lot of stress, then that's why you're more likely to induce pain, and hence the stress syndrome. That's the first theory. The second theory is what's called a stress reaction. So whenever you go to the gym, for example, in order for a piece of a tissue, so that by tissue you mean bone, muscle, or tendon, in order for that to get stronger, you're going to need that area to be somewhat, it needs to break down first before it can build itself back up stronger. So this can happen the same thing with bone. So that's why we see stress fractures, because in this temporary weakened area of bone, when it's going to get stronger a bit later, but it first breaks down before it gets stronger, this is where it's most vulnerable to the stress, and as a result, the stress fracture can occur following this. We call it a syndrome because there are multiple causalities, not just one. So that first theory is of muscle pulling on the area, pulling on fascia in the periosteum. That's theory one, and then the weakened bone stress time is theory two. But this could be a combination of both of these theories for one particular individual. So this is a syndrome. There isn't one specific cause, and that's the case with most syndromes, right? Now, what I want to do now as well is to sort of debunk some theories and some misunderstandings. So, when a lot of people have shin splints, this is in the medial, so the inside of the tibia bone. What you may experience is on just to the right or left of that, so just away from the middle of your body, there's this muscle that goes along the front of it. And that's called the tib anterior, and you can experience pain with that. Now, that isn't the same thing as stress syndrome. This is usually a muscle-related issue because of a lack of strength in the calf, as well as a lack of mobility in your calf as well. Now, the way to get rid of this type of pain is strengthening and lengthening the muscle as well, with improving its function under load, etc., following a progressive program. Now, that does not mean that you have shin splints, so that's a myth that people have. They're different things. The second thing is if you experience some numbness and pins and needles in the foot, cramping and burning sensation maybe at the back of the calf and around that area, that's usually another differential diagnosis, which is called chronic exertional compartment syndrome. And compartment syndrome is something to do with the vascularization of the tissues in that area, not really to do with the stress on the bone. Okay, so that's another thing. So if you're experiencing numbness and pins and needles in the foot along the distal, so the furthest away part of the tibia, it's unlikely that that's shin splints, and that's a different diagnosis, so you need to get checked up for that. Also, as well, another myth is if you get some tenderness on touch, sort of around the tibia in some local areas, that's again a myth to think that's shin splints. It's mainly actually something to do with a potential stress fracture rather than it being a shin splint. So it could be the continuation of these shin splints that causes the fracture. There, you definitely need to get checked out for that as well with X-ray. Get your local GP, physio, and have them assess you. Now, as I previously mentioned about the anterior tibialis pain, it comes from the muscle, which lies on the front lower leg and attaches to the top of the foot. Pain in this area can be confused with shin splints, which is pain on the inside. We need to make sure that we realize what that is the case. It's not the same thing. Now, briefly, we're going to go over how we can deal with this issue. Now, first off, it's a stress-related issue, right? So, borderline and the how you improve this is if your amount of capacity to withstand what you're doing, so your body is not adapting to the demand. So if you're going through these frequent runs consistently and getting these the stress syndrome, what it means is your body's not adapting fast enough. You need to adjust your program accordingly and monitor it. So give yourself a few more breaks in between sessions, right? One at different distance, one on different, whether it's on tarmac or grass, change it, because that's what the issue is. It's the continual stress on this inside of the bone. You need to make sure that you are monitoring yourself. Do not push it. And that's the most important thing. It's not rest. It means you need to adapt your training accordingly. You can... yes, it does mean you might need to take more time off, but recognize this and nip it in the bud before it gets any worse, right? So that's the first thing you want to do. Second thing you can look at all the neighboring tissues that are connected and strengthen them progressively. We're looking at the gastric and soleus mainly, and the tibialis anterior that I mentioned before. If it is shin splints, it's likely that these muscles are pulling, so you want to make sure that they're strong enough and not pulling. That's what you need to be doing. A second thing that you can do is If you are running and you still want to get your exercise in, you can transition to non-impact exercises rather than repetitive loading via running first, and then gradually progress back into running once you're a little bit stronger and have done some resistance exercise. Now, resistance exercise should go alongside the cardio, not just on its own, especially if you're going to try and get back into running. That's going to, actually, your body's not going to adapt to the repetitive loading if it's not doing some loading itself. So definitely get back into running, but you want to take a break first, do some other non-impact exercises to accommodate for it. Third and fourth we have here is, aside from physio, what can you do on the medical when it comes to treatments and medications? One of the things that I've been giving to some clients is a compression sleeve that helps with inflammation, can aid with the periosteum that I mentioned and periostitis, stop the inflammation from getting worse, and compression can do that. So a sleeve is a good way to help whenever you're on your feet to reduce that rubbing and pulling. The second thing is there are theories that a low vitamin D and calcium diet, so improving your intake of those specific vitamins and minerals, can reduce the incidence of stress fractures, and has been shown in studies with military recruits that when they did have some vitamin D supplement and calcium, this improved greatly. The fact that you're outside getting some vitamin D naturally is going to help. Just make sure that you don't lose that calcium, because again, this is a stress-related issue with the bone, so therefore you need to improve bone healing with calcium. So that's going to help as well. So that is our live on MTSS, so medial tubular stress syndrome, and hopefully you got something out of this. Yeah. Right.